Welcome back to the Patient First Podcast. I'm your host, Dr. Bryan Laskin, and as always, I am so excited that you're here. And today we are going to talk about a big topic, a big popular topic in dentistry, which is the medical-dental connection. Medical-dental connection, and specifically about the medical-dental health record systems connection. What prompted this? Well, there's a study by CareQuest. If you don't know CareQuest, a great organization that do lots of research in dentistry, that 100% of dentists surveyed agreed upon something. Now, think about that for a second. What in dentistry does 100% of dentists agree upon? I can't think of much. If the very first podcast I ever did was 4 out of 5 dentists prefer, I think it was Trident, the commercial. Can't even agree on a gum. But 100% of dentists surveyed said they want access to their patients' medical records. 100% of dentists want access to their medical records. That is profound. That's profound. Why? Why do we not need access to their medical records? Because we need to know when we treat patients if they have certain diseases, right? Now, I would argue that we don't want to have access to their entire medical record because, frankly, it would be a lot of noise, right? We don't want to know if a patient had a wart removed. We don't want to know if a patient had hemorrhoids, right? We need to know if they have diabetes, heart disease, if they have high blood pressure. There's certain things, certain medical conditions that we need to know because it affects their oral health and vice versa. But we do need to access some of our patients' medical records so that we can provide the highest quality of care. But we don't have any access of that today. And that is why 100% of dentists surveyed, in my opinion, want to have access to their medical information. But we don't have any connection between the medical systems and the dental systems. And this has led to some massive problems and why it's not being done. Number one, fewer than 42% of dental providers at co-located facilities, meaning, facilities that actually are in the same organization, can use their health records EHR system to enter information into medical records, right? So the dental providers cannot put information into the electronic health record system because it's a medical system, not a dental system, right? The EMR, the electronic medical record, and the EDR, the electronic dental record, are separate. Is this bad? I would argue no. The dental record and the medical record has been, will be, should be 2 separate systems. Because like I said, I don't really want to know if a patient had a wart removed, not because I don't care about the patient's wart being removed, but because it doesn't affect the dental care I deliver and it's noise. And if you have all the information, the critical information gets buried. So I want to have immediately right in front of me the medical issues, the problem list that the patient has, the medication list. Those I should be able to see because that directly affects the oral care they're given. And importantly, the physicians, I hate to say this, they don't care about the vast majority of dental care about their patient. Now they need to know if the patient has raging periodontitis or a necrosing palate, but do they need to know that there's an incipient lesion on 14 mesial? No. And if we pass that information, all of our dental record to the physician, what's going to happen? They're going to ignore all of it and think it's the dentist's problem. So that is why we need to keep these systems separate. However, 100% of dentists want to have access to that medical information, which I agree with. So what we need to do is connect our systems in a meaningful way, having the medical record and the dental record separate but connected, where we have interoperable, where we share data that makes sense to share. So another statistic. Twice as many medical providers as dental providers are able to identify medications prescribed to patients by providers at the other. So that means that twice as many physicians know about the medications that dentists prescribe than the other way around. And guess what? That's not going to change. Medicine is 10 times larger than dentistry. So we are a much smaller industry, and it is up to us to get the information from our medical colleagues so that we can view it. The medication list, right? So the answer that we have to connect our systems so we can have a high level of information that we need, and vice versa, the high level of dental information that the physician needs, is called connected dentistry. We connect our systems in a meaningful way so that we can pass the information in an obvious way so that we can leverage the good data that we need, dig deep if we need to, but filter out the noise that we would have if we have these massive systems that are coming into our industry. Let's face it, there's a lot of large organizations that are using Epic as a dental platform. Let me be clear. Epic, to my knowledge, is the reason why the 21st Century Cures Act came about, because they were doing such egregious information blocking practices that the federal government got involved and said, it's illegal what you're doing. We're creating federal regulations so that you have to give access to the information to physicians, to patients. That is, and people are saying that's the company we want entering dentistry, and we want dentistry to become a subset of medicine. Oh my gosh. Think of how medicine gets paid. I go to a lot of medical conferences, and when I talk about elevating care, the first question that we ask is who's paying for it? That's the first question that gets asked. In dentistry, we can talk about care and not talk about insurance companies. Why? Because dentistry is less expensive. It just is. It's more efficient to deliver dentistry than medicine in a host of different ways. And if we merge dentistry and medicine, it is going to be worse for absolutely everybody except for health insurance companies. And guess what? They don't need the help. They are doing just fine. But I realize, and I totally agree, that 100% of dentists want to have access to their patients' medical information, and they should have it, and it should be in a meaningful way within the dental record. This is a nuanced discussion that is being leveraged by some in the industry, I believe, to try to oversimplify it and say the medical record and the dental record should be the same thing. We will solve a problem. Absolutely. We'll solve the problem of getting dentists access to the medical information, but we will create much larger ones. Large medical systems, that innovative platform that's new to dentistry, is it going to work with Epic? Come on. The answer is most likely no, right? How important is the industry that's 1/10 the size to the large system? Not much. And by the way, it's not like these are super innovative companies to begin with, right? So the answer, my friends, of getting access to the medical record is connected dentistry, connecting the separate electronic dental record to the separate medical record in a meaningful way so that these systems can pass the information to the people that need that information when they need it, but filtering out so that we're not overwhelmed with a bunch of information, using bigger systems that are less innovative and not integrating with the rest of the applications that we use in dentistry. How many dental applications integrate with electronic medical records? The only one that I'm aware of is tooth apps. And the reason why is because we are a health information exchange for dentistry. So the goal is to create that connection with medicine because nobody else in dentistry does. That's the answer, my friends. I totally realize and agree. Let's serve the dental industry, get the medical information to dentists when they need it, but keep our systems and our industry as separated as possible to ensure that we don't get gobbled up by an industry that frankly has a lot of problems. Regionality, that we don't have in dentistry in a lot of ways. Some massive, massive tech companies that are doing things that, frankly, I don't think we would want in our industry. Payment solutions that, if we can avoid them, I think it would that would be good. There's costs, labor issues, all sorts of problems that are going on the medical side that we don't have on the dental side. I mean, we have our own boards, we have our own licensing programs, we have our own schools, as they say in Seinfeld, right? We we should definitely have our own record systems. The electronic dental record, the electronic medical record are two separate records that need to be connected. Thank you very much. This is kind of controversial because some people do believe that dentistry should become a subset of medicine. Absolutely. It's a trend that's going on right now in dentistry. People also believe the electronic medical record systems should replace what's going on in dentistry. I disagree. Do you? Let me know. Like, comment, subscribe below. And as always, thank you so much for showing up for the Patient First podcast, and I'll see you next week.